Oh, welcome everybody. Here we are. I am here with Dr. Shelia Craig Whiteman. Is that correct?
That is correct. That's me.
Welcome, welcome. Oh, this is just
Thank
really
you.
exciting, really exciting. I just want to read a little bit about Dr. Shelia. She is the best-selling author of To Pee or Not to Pee, the guide to reducing and eliminating bladder leaks. She is a physical therapist specializing in pelvic health, which is very important, and she'll talk all about that. During her 30 years of physical therapy practice, she began to realize that there's a need for women who have had pelvic health problems to be able to easily find treatment and help for their diagnoses. And I'm 60, almost 62. I can attest that as we age too, we definitely have more challenges with that.
Yeah.
In addition to pelvic health, Dr. Craig Whiteman is also certified in lymphedema and oncology rehab. Beautiful. I'm a nurse by background, so you're speaking to my heart.
Excellent. Yes. Yes.
So she received her BS degree from Ithaca College and a doctorate in physical therapy from Boston University and is a licensed physical therapist in the state of Maryland.
Mm-hmm.
And in addition to physical therapy and writing, Dr. Craig Whiteman is the owner of Interim Health Care of Prince George's County, a home care agency which provides and services to seniors to allow them to remain safely in their homes. And this is where I read this in your bio and it just went deep into my heart because that's where I started out, is working with our aged population. And I have a almost 96-year-old mom who lives with us, so that we
Oh, wonderful. Oh my gosh.
so
What a blessing.
we have some connection there. So that's
Yes.
my heart. My heart was always geriatric nursing and that type of thing.
Mm-hmm.
Yeah, and as an advocate for health and well-being, she has led many presentations, fitness programs, and volunteer activities in her community. And in her leisure time, she can be found teaching cycling and Pilates classes. Ooh, like that too. So I'm going to put all of her contact information wherever I post the video, but her book can be found on Amazon.com. And for a free download, I'm actually going to put the link in there. It's kind of long here. And her email address, which is the pelvicdpt@gmail.com. But I will put all of that information because I just know that there's going to be a lot of people that are highly interested in this subject, as I am. And so I just want to share to people, I've been doing these interviews for fun. I've met these beautiful people through a business coaching for authors, and where we have written books so that we can take them out into the world and serve our communities and anybody we come in contact with to help them lead better lives, joyous lives. And so that is where Sheila and I have connected. And so I said, okay, if anybody wants to be interviewed, well, we'll do it on Zoom and we'll kind of get it out to the world. And so you raised your hand.
I did.
So my first question is, what made you raise your hand?
Oh, I raised my hand because I think the topic is so important. I think it's something that, and that's bladder leaks, but it's also even women's health. I find, and when I was in the clinic, I found that a lot of us just don't have the basic information that we need in order to make sure that we stay healthy and that we take care of our bodies and not accept things that don't have to be, for example, people think that leaking is normal because you age. People think having issues with painful intercourse are normal because you age. But there are things that can be done to either stop, mitigate these type of issues. And I just really felt it was so important from hearing over and over women saying to me, really? I don't know that. Are you kidding me? And I thought that that's something that I just need to put out in the world, because to me, it's important for all of us to know how to live our best lives, if at all possible.
Wow, that's amazing. So I'm just going to use myself as an example. I've gone through fluctuations in my life where sometimes it's like, oh, I cannot hold it and it's leaking out. And then all of a sudden, I don't know what I do, whether it's subconsciously, then it's like, okay, I'm doing much better. And then I go through a period of life. And then all of a sudden now what I'm finding is I'm drinking a lot more fluids
Mm-hmm.
because I'm on Weight Watchers. I started Weight Watchers, so I'm drinking like
Oh,
an
great.
enormous amount of fluids. And
Yeah.
all of a sudden it's like, oh my gosh, I can't get to the bathroom in time.
Yeah, yes. So, and a lot of women fluctuate through life with incontinence, actually, or bladder leaks, because it doesn't necessarily have to be so much that it comes through your clothing, because people associate that with either having to wear a pad because it's a problem, or having to wear other garments. Leakage, even if you have a couple drops that come out, say, for example, when you're running to the bathroom, pulling down your pants and, a little extra
Yeah.
meet you before you get your pants down, that is considered a form of leakage. So and it ebbs and flows. So if you say, for example, you are pregnant, you 10 to 1 going to have leakage. If you had a child and you had natural birth, you will probably have some leakage afterwards, but it usually self-corrects as the muscles self-correct. As we go through, women, we also go through hormonal changes. So you hit that perimenopause. Same thing, you might hit a little bit of leakage there. Menopause, you're going to hit a little bit of leakage. And sometimes it'll go, come. There will sometimes, though, come that point where it won't go. So, you'll get those couple of drops and then it'll happen more and more and more. And that actually is the pattern that I found in the clinic. It is not that you wake up one day and you're just leaking. That is not the way it goes. It's usually progressive, and it's usually progressive over years. So I wanted to be able to let women know, and actually men can get treated for this too, it's just not as common, but so I'll say people. Let people know that when you first begin to have the problem, don't wait so long to get intervention. Because the longer you wait, the more effort it takes on your part. My part is just encouragement at that point, but it takes more effort on your part in order to get it under control. And it's not, for some people, it's easier than others, yes. But it's not something that you have to say, okay, this is my life. I'm going to, just be in pads, diapers as I get older, and it's okay. It's really not okay. Try to make that effort. Those pads and those diapers cost. They actually cost a lot of money. You can really get some good shoes, purses, et cetera, with that money.
Oh yeah, I'd much rather have purses and shoes and clothes and all kinds of
That's
fun
what I'm
stuff.
saying. Yeah. So let's kind of nip this in the bud, and then we can just get whatever, extras we want to get.
Oh, that is so beautiful. And I imagine that people are probably being more open about this. I'm thinking about my mom, and her generation. It was something that was just not spoken about.
No.
And then she had surgeries, and then she got scar tissue and all that. And I remember that she had a bladder repair back, oh gosh, probably 40 years ago. And it was so extensive. And I thought she was going to die. I really did.
Yeah.
It was so terrible because she had just kind of suffered through that. And so to have had someone like you there back in the day might have prevented, I would imagine, some of that.
Yeah. Back in the day, we really didn't exist per se. It's really a newer, and when I say newer, probably I would think maybe 8 to 10 years. There are a lot more of the younger therapists getting into it now because, old G's, we've, paved the way. But say 15 years ago, you probably could not even find really a pelvic therapist. They were not that many of us in existence. So when your mom had her surgeries, that was the method of treatment for everybody. So it's not that anything that was done, wrong, incorrectly, that just was the method of treatment. The thing now, though, is that even though physicians do say, okay, well, I can do surgery to repair your bladder, and I'm going to back up. And you can ask a question, but I get excited when I'm talking about this. So I'm going to back up. So if you've had a lot of children, or, even for some people who haven't, your bladder can prolapse. It can start moving down. So that's probably what they repaired. So when you go to physical therapy, though, we have exercises. We have some interventions that can, if it's not like a grade 3, but the grades 1 or 2, we can help to lift them back up. That option was not available then. And now people ask a lot more questions from their physicians, because they still do recommend doing that surgery. You hear that a lot. Before it was using the mesh, and they're just using different things. But people question more too. What else can I do, besides surgery? Whereas back in the day, if your doctor said do something, you kind of did it.
Yep.
Yeah, and now it's not so much. A lot of us are saying, well, what do you mean? What do you do? What's the alternative? So it's great that there's an alternative out there.
So is there, now I'm a nurse, but I am not specialized in our pelvic health, but we have muscles and that type of thing. Is there a muscle memory that we can engage in there?
Yes, there is muscle memory, yes, but initially you have to be able to engage the muscle properly. Okay. So, and that's that quote unquote Kegel that everybody talks about, but nobody really knows how to do. So when you come into the clinic, you can come to the clinic, you can do it through, I do it through a coaching program. So it's not necessarily that you have to do it face-to-face, because I've been successful without doing the face-to-face and going in. But you have to really learn how to do a Kegel. So when I was in the clinic and actually doing this on a daily basis, and we check to see if the person is doing the contraction correctly, if they're hitting the correct muscles, I would say 90% of them were not. It probably is even higher than that, but I'll say 90% of them were not. But they thought that they were. And that's why when women say, I've done Kegels, I've done it, it just did not help me, because you're not doing them correctly. You have got to hit all the muscles. There's 3 layers of muscles down there. So you have to hit all of them in order to get the result that you need.
Wow.
I know. Yeah, once you get it and you get it correct, you will continue to do them correctly. But you have to learn how to do them initially. And I really think that that's the biggest problem that a lot of women have when it comes to doing Kegels. I call pelvic floor contractions, because that's exactly what they are, is that you don't quite understand how to do them. And it's not explained how to do them. Like, you can read and you can, but you have to have some kind of feedback too, as to, for someone who knows how to do them, as to how to do them properly.
Okay. So something just came into my mind. So back in nursing school, so like I said, I'm going to be 62 here shortly. So I was in nursing school, and it was a training program run by nuns, and the hospital was run by nuns. And so they were our teachers. And I remember this old nun telling us that we had to do the Kegels. And I mean, so she was quite elderly. I remember that. And, and I was, what, 18, 19, maybe, and thinking, what is this all about? And really didn't pay a lot of attention. But now her voice is coming back to me, like she must have had something, probably some knowledge back then, that she understood that was important, but whether they did it correctly is probably a whole nother conversation.
Right. Yeah, well, that is very true. But that's nice, actually, though, that she said that. That's unusual. This is coming up from the girl who went to Catholic grade school and Catholic high school. We didn't have those conversations with any of the nuns or anything even close.
Yeah. So she's just coming in my mind's eye, and I'm like, wow, you're kind of ahead of your time, sister.
She was. I know, right? Right? Yeah. But
go ahead.
No, I was going to say, but the fact that but that's still the problem that is going on now, is that people say it's very important to do them. and that's about all you get.
Mhm.
And that's why it's such an issue with women believing that they're doing, because we all have the best intention. And if you squeeze down there, you're going to feel something, because the vaginal sphincter and the rectal sphincter are interconnected. So you're going to be able to squeeze your rectal sphincter if you're not incontinent about. So you're going to squeeze that, and you're going to be like, I feel something, so I must be doing what I'm supposed to do.
I'm squeezing right now. I'm wondering what I'm doing wrong.
So, and it's you actually have to focus, and I don't know how much you want to get into it, but when you're squeezing, you're going to feel the rectal sphincter. That's what you're really going to feel, and you really have to try to differentiate. And it takes sometimes a minute or maybe a session or two to be able to get a good contraction, because it's not something that you will get unless you've been doing them almost correctly. It's not something that in your mind it's easy to pick up.
Well, I would bet that people who are listening are we're all kind of like, oh, let me just try this here as I'm sitting.
Right. So try that squeeze, and then really focus on, so what do you feel when you do that squeeze? Is it the back or the front? And 10 to 1, it's going to be the back. Even if you squeeze the front, you want to squeeze, and then you want to feel a lift of your muscle. So it's that squeeze and that lift. And the lift is where everybody falls off, is the lift.
Wow. Yeah, I was feeling it in the back. So that's amazing. So talk to me a little bit about, well, there's just so much I want to talk to you about. But while we're on this subject of, this is for like incontinence, that type of thing, I would imagine that there's a correlation also with our sexual health, and this would help. Are there things there that are helping with the Kegels and that type of thing to help, with intercourse and that type of thing? I mean, let's just throw it out there. Let's talk about it.
Yeah, so if you are able to have a strong pelvic floor contraction, aka Kegel, it improves your ability to have a better orgasm. It actually improves blood flow in the area, and it strengthens the muscles and improves the integrity of the area. So it's a muscle. So anything, now it's not going to stop the atrophy from menopause of the soft tissue, because you do, as you age, and that's starting even at 35, as your body does start to degenerate. So it has nothing to do with the, 40, 50, 60, 70, it starts to degenerate. But you can keep, just like if you look at someone who does not exercise at all, and look at someone who does do exercise and see a little bit of definition, see a little bit of tightness there, it's the same principle almost. You can actually even have more comfortable intercourse, more satisfying. So it's all really kind of intertwined in your sexual health, your incontinence, your ability to keep your organs where they're supposed to be.
That's awesome. Now, I am a practitioner and a teacher of Qigong. And in the Qigong theory of this ancient Chinese wisdom, there's a 5-element theory. And where our sexual organs and our bladder and all of that all are part of the kidney energy system with that. So this is just like really cool, because the emotion that can block our kidney energy, and which can affect our sexual health and our bladder health and all of that, is the emotion of fear. And so beautiful. I'm bringing this in because we know there's a lot of fear out there in the world. There's a lot of we not even just out in the world, but within each one of us, and things that are going on in our own personal lives, and it's almost like to be able to meet up with someone like you, get coaching with someone like you to really focus on the actual health, I believe, is probably opening up that kidney energy, which is our vitality. You know, so the
Yeah.
bladder health and our sexual health, that's all part of our vitality. And, you know, we know what happens, you and I in the medical profession, if our kidney health is poor, what happens? We're probably not going to stick around a long time.
Right.
But all of this kind of stuff, it's just like all of a sudden I'm going ding, 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 ding. This is awesome because there's actually something that someone can be doing to help consciously open up, not just with their sexual and pelvic health, but their kidney energy systems to provide vitality. Because yeah, to pee or not to pee, we want to pee when we're supposed to pee,
Right.
you know, and we want to have great sex when we're
Right.
having great sex, right? And so all that
Right.
brings vitality. So yeah, I just had to throw that in there, that it's I'm seeing some connections going on here.
Very interesting. Yeah, that's very interesting.
Yeah, so you're helping people with their vitality in ways that maybe you hadn't even known.
I have never looked at it like that. But I have looked at it, and you can see, depending on what I'm treating the person for, you can see a weight lifting from their shoulder. Literally, you can feel and they see a weight lifting from the person. Especially when you're helping someone who has pain with intercourse. The people come in crying when they really have mastered being pain-free or mastered management. Those women who have significant leakage, the same thing, because it really drains you. It really drains you, and it's so insidious the way it happens, because it happens over a period of time, and we all adapt. So okay, well, this month it was a couple drops. Okay, well, I've adapted that. Couple more drops. Okay, I've adapted, and then you have to look back and say, wait a minute, what happened here? Like, how did I let this get under control? But as a species, we can adapt to a lot. Mm-hmm. And then you have to remember, well, let me see if I can do something to fix this and live better.
Right. And I think about that fear that I talked about with the kidney energy. I mean, think about, I've been there. Like I said, it's waxed and waned over the years. Mm-hmm. Then all of a sudden, oh my gosh, I forgot to put a pad in or a panty liner or whatever. And so what if I cough or sneeze and then I wet myself?
Right.
There's almost that thing, anxiety, that worry,
That's
like, oh,
right.
Yeah.
Mm-hmm.
Yeah. So this is very exciting. Very exciting. I'm learning so much.
Oh, I'm glad.
So can you just share a little bit, like, not to go into great detail, I know, but just share a little bit about your coaching program and what you do, kind of how you help your clients.
Yeah, sure. So what I do is the first part of the coaching program actually is to figure out what is going on with you. It's not cookie cutter where everybody is the same. So in the first session, we actually work on trying to figure out what are your symptoms and what interventions are needed. And what that is usually you have to track your habits for 3 days. And then once we look at them together, we can see, usually you can see patterns. And some of the patterns I'll see, but you won't, because you don't even know what, you're like, I don't know what I'm looking for. This is the way it's supposed to look. This is what I've been doing. So this is great. But when I look at it, I'm like, what? Okay, well, let's talk about X. Let's talk about, why do you go to the bathroom so much between 8 and 11? Let's look at why that is, and let's see if we can fix that. Let's look at, why are you getting up at night more than once to go to the bathroom? Let's see if we can fix that. Why did you, when you exercise your 3 times a week, are you leaking a couple drops? So we have to look at the whole picture. And sometimes there's other things on there. People always will say to me, because my program is bladder leaks, but if we see something else, because sometimes there's other things in there, then we'll talk about those and, do either self-correction or work on them maybe after the program is over. Because I won't say most, a lot of people have things that they're not aware of. And I can actually give you an example. When I was, this is going back years ago, so I had a more vibrant bladder and everything else. So, but when I went to some of the courses, whatever we do for you, we have to do to ourselves. So just know that. So we have to do a bladder diary in the beginning. So we go and do the bladder diary, and the classes last a couple days. They're not just one day. So you go and it's like 3-4 days, whatever. So I filled mine out, and I'm, we're looking at them, and I'm looking at mine like, oh, this is pretty nice right here. This is good. And then she starts talking in the class. I was like, well, I have that. And I'm looking down the pen. I can see that right here. And, it just opened my eyes, because as a PT, but I wasn't a pelvic health. I was learning how to be a pelvic health PT. But I was like, oh, this is very interesting that I'm here thinking, well, this is great, right? This is great. Boy, she's going to look at this. This is going to be really nice. And I'm looking at this, and that looks like I have frequency, right? Why am I going to the bathroom so much right here? So it was hilarious. So I always remember that story. This is going back so long ago, but I remember that story because it helps me to understand my clients because it's the same thing. And they don't even have the background information. So they're filling this paper out like, this is fabulous. She's going to look at this. It's not going to be too much on here. A couple of drops over here. And then I look at this like, oh, my. Well, let's talk about this and this. And they're like, oh, is all that going on? Now we'll fix it. But like, oh, this is happening? Who would have known? So, yeah.
I'm just like, okay, didn't get an A on that one, did we?
No, I did not get an A on that one, and I still laugh about that to this day because of what he's talking about. But yeah, so it's kind of the beginning of the program, and then most of the program though was a one-on-one. So I do have modules that are informational. So the modules explain to you, about the how to do a Kegel. Because we do have to know that. And then we'll go through and really learn how to do it. Then there's a module on how to do the correct exercise for what's wrong with you. Because not just, walk down the street, do some Kegels, sit in your chair, do some Kegels. It's not like that. It's an actual program. So that. And then there's also additional exercises that you can do, bridges, squats, those kind of things that you can do to improve the integrity of your pelvic floor. So we go through those also, and then determine which ones, number one, you're able to do without having an issue. And then number two, which ones would be the most beneficial for you.
Wow.
Yeah, and then there's a few more in there, but yeah, so that's kind of what we do. I try to really personalize it for the person. And don't get me wrong, there are certain categories. So say, for example, you have stress urinary incontinence. Your program is not going to veer off from the next person that has stress urinary incontinence. It just might be that you learn the exercises differently. It takes you longer to understand what you're doing. And then the auxiliary exercises might be different for you because your hip hurts, you got knee problems. It could be anything.
Right.
But so the exercise has to be tailored to you.
And that's what I was going to say. It sounds like a tailor-made, very personalized program, even though that there's going to be common, protocols that you're going to probably, recommend for everybody. But I may have something that's totally off or something that's going on in my life, like, I just can't do that. And so and that's the beauty of coaching. And I always like to plug coaching in when we're having these is that, we're medical professionals, we understand all that, but coaching is just such a different way of interacting because it really is looking at the real personalized approach and what works for the clients, right? So what their dreams and goals are, and how you can really make it so that it's tailor-made for them, because we're all different and we all have different ways of moving forward in life. But people are coming to you because they want help.
Right, right. And it actually is a coaching program. So that it's you, client, are the person who really is driving your success. I'm guiding you towards what you should be doing, but this is coaching you through the steps that you need to do in order to get to where you want to be. So there's no diagnosis, nothing like that. You can come with a diagnosis from your doctor if you wish, but we're going to look at where you will fit in and then coach you to where you should be for success.
Wow, beautiful. And I had just read someone who is in our program, one of our coaches, who just wrote a beautiful testimonial about your work, that you had
Yeah.
come and she had interviewed you on a podcast and then hired you, and some beautiful results. So I want people to know that. Now, can I just veer off a little bit? And
You
we
can.
talked about the pelvic health, but this is near and dear to my heart. So can you just share with me what drove you to start this home care, and allowing people to be in their homes? That really feels like it's just such a soul's purpose for you. So can you talk a little bit about that?
I can. Now, it's a hard business. I'll start off by saying that because I actually, even before this, I was at a client's home all this morning. So, yeah. But I have been driven, even though I've done, you mentioned the pelvic health lymphedema oncology, but I've always been drawn to, back in the day, it used to be called geriatrics. I've always been drawn to working with older people. Even if I worked in a hospital or whatever, or in my private practice, because I had a private practice doing physical therapy, a lot of times I would have a second job a couple of nights a week working in a nursing home doing physical therapy, because I just love it. It's like the best to me. They're like the most fun. And you learn so much from older people. You can learn so much. So always have loved working with them. And I said, when I stopped doing physical therapy, and I'll back up, I wanted to do something really to enrich older people's lives, because I did see a lot of sadness. So, I saw a lot of them, of families not being able to handle the person because of their medical issues, dementia, etc., and they had to go to a nursing home. And some nursing homes are okay, but yeah. So I'll leave that there. And I wanted more people to be able to stay home, and for the family to feel comfortable that somebody would be able to take care of them and they can stay, and they would not have to worry, because as a caregiver, you still worry about your family member who you're taking care of. And it's really hard, number one, to trust anyone, or to just feel comfortable that you can let go for a minute. So it's twofold. The caregiver, they work so hard and need a break. The person who we are caring for needs someone who cares for them like they were their parent. So that's kind of what I've been building and what I strive to build, only because it's just important. It's just important to me.
That's so beautiful. And I just, as I had mentioned, my mother lives with us. We're in a multi-generational home.
Wonderful.
And I used to work in the nursing home too. That's what started me in healthcare back when I was 17 years old, is going and working with my peeps there, who I just adore and love. And to be able to take this forward, I love this so much, because that is where the heart is. And our elderly are our wisdom keepers. They're the ones
right.
that absolutely, and in most cultures, they're revered.
Yep.
I think here we kind of steered away from that, and when nursing homes and those kind of things were starting to become the rage many, many years ago. And And it is difficult. It's difficult to take care of someone at home. So to have these beautiful home care agencies, and I am absolutely know, without even really knowing you well or your agency, that it's filled with heart, because you're
Yeah.
filled with heart, and your mission is to just be able to provide this. So I'm thanking you on behalf of all of the elderly in our world.
Thank you.
That what a beautiful thing that you're doing there, and I wish I lived close to you. I'd come work for you a few nights a week.
Oh, I wish you did too. I'm telling you, I wish you did. Oh my goodness, because staffing is something. Oh, it is something. Yeah, and
Yeah,
you have to vet out the best people.
yeah,
So,
yeah.
yeah, especially in this COVID time, it's a little challenging.
Yeah, I actually have signed up to help out when we need it in Minnesota here. I
Okay.
haven't worked as a nurse for a long time, but I thought, no, I can go, and I can go to the nursing homes and, help out and do what I need to do there. So, yeah, just waiting for the calls when they come. And so,
Right.
well, I just, wow, this is so much fun. It's so much fun to get to know you. And
Yes.
to pee or not to pee, that's going to be like, to pee or not to pee, that is the question.
I know. I couldn't let that title go. I just couldn't.
That's awesome title. But what I would like, and again, I want to remind everybody that when we put this out into the world through our Facebooks and our LinkedIns and our newsletters and all of that, all the information to be able to reach out to Dr. Sheila will be in there. And also I want to remind people, you don't have to see her in person. She does this coaching over the internet. She has success over the internet. So it's not like, okay, I've got to be out east and have a physical
contact
or consultation. You can do this over the phone. So I just wanted to let people know that it's the beauty of what we have here in the virtual
connectivity
world. Connectivity, absolutely. So we will have all that contact information, but what I'd like to ask you before we go is, what is one thing you just want to make sure that people leave our conversation with? What is one piece of wisdom that you have?
The one piece of wisdom, or this is just a statement, is if you have any issues, and I'm going to go even further than pelvic health. So if you feel that you have anything going on in your body that you are not happy with, don't let it stay. Now, you might not be able to change it, but I want you to think there are many doctors out there, and there are many ways to get help. If your doctor, and I'm not saying don't believe your doctors, but I'm saying educate yourself so that you will be able to ask the appropriate questions to be able to live your best life pain-free, worry-free, embarrassment-free. So that is the main thing. I just really want you to educate yourself on your health. If you do that, you will have done the best that you could do.
That's beautiful. That's beautiful. Well, thank you so much. It's an honor. It's an honor, and I'm so glad that I got to know you. This is why I do these things. It's just so much fun for me to get to know new friends, meet new friends, and gain the wisdom here. So thank you so much. You are such a beautiful soul put into this world to just do so much for everybody. And it's an honor to.
Thank you. I say thank you too. This was really a lot of fun. It really was. And it's just nice you're right, to be able to meet each other and talk and learn a little bit about each other. It was really, really nice. So I'm happy that you're doing this. Great idea. And I'm happy that I was able to be a part of it.
Thank you. Thank you so much. Okay, well, I'm going to turn off the recording. We'll get this out to everybody. Thank you so much.